Hello everyone. I am Dr. Pankaj Tiwary, a practicing dermatologist from city of Patna and associate professor in Patna Medical College Hospital. And I am talking on behalf of DermaVidya and Access to Dermatology World. Today we will be discussing on eczema and contact dermatitis, two very common skin conditions that can significantly impact daily life of any individual. In this video, we aim to provide a clear understanding of what eczema is, including its various types, with a special focus on atopic and contact dermatitis, the most prevalent form. We'll also deal with contact dermatitis, distinguishing it from the two types, irritant contact and allergic contact, with other eczema forms, and by exploring the causes, the triggers, the symptoms, and we'll help you, equip you with all the knowledge to recognize eczema and how to deal with it. We also help you to understand the diagnosis process, including there are some investigations like patch testing, like IgE testing, which is effective and crucial for the management. And we'll cover a range of treatment options and offering practical tips for managing flare-ups and also considering the broader impact what these conditions have on the quality of life of you, on your life. Additionally, we'll also debunk the common myths like foods which are associated with eczema. We'll discuss the influence of diet and we'll provide guidance on skin-friendly products and clothing choices. So coming to what is eczema? Eczema is or dermatitis is a condition in which there are oozing, there is thickening, there is crusting over the skin. Either it can be localized or it can be generalized. Eczema is broadly of two types. We call it endogenous when the cause is from inside like atopic dermatitis, or it is exogenous when the cause is from outside like contact dermatitis. The most common one, which is the atopic dermatitis, it is a type of dermatitis which causes very much impact. Particularly it has three different time of onset of in life of an individual. In the children, which is called childhood type, then in the adult type, and at the last end of their life, which is called elderly type. So these three peaks are there, but this atopic dermatitis can trouble the individual throughout his whole life. The second one is contact dermatitis. It can be of two types, as I said, allergic contact, in which the chronic irritation by any kind of element, any kind of metal, any kind of chemical can cause resurgence of these eczema features, the dermatitis feature. And the second one is called irritant contact dermatitis, in which there is touch with any kind of chemical which is very harsh, like some kind of acids, some kind of plant acids, some kind of plants, some kind of animal products, which will produce immediate burning, immediate rashes, immediate itching. Then we call it irritant contact dermatitis. Now coming to the causes and triggers. The common causes, as we said, the endogenous causes we cannot deal with because it is seen in genetically predisposed individuals, genetically susceptible individuals. But the outside, the exogenous causes, we can prevent to some extent, but in a daily routine, an individual like a doctor cannot deal with without writing a prescription. So if he gets allergy with the chemical compound in the pen, then it is very difficult. So similarly, there are a lot of things which are coming in our contact with in a daily basis. So it is difficult for an individual of contact dermatitis to get benefited by just looking at those products only. Now coming to diagnosis and testing. So the process of diagnosis, there is one blood test which is called IgE level and the serum eosinophil count, which is helpful for individuals who are suffering from atopic dermatitis. While there is a test called patch testing, in which there are lots of pre-filled syringes of chemicals which are there in the common our day-to-day life in which we are getting contact. So there is a patch testing with these common battery of chemicals, and we will get the response and we will just delineate those causes, those chemicals and those things in which those chemicals are found, and will tell patients that you are allergic with this chemical and this chemical is found in these common things, and you have to get yourself protected from those materials, those chemicals. Now coming to treatment options, there are a lot of treatment options, and the main thing is immunosuppressant or immunomodulator. We all know steroids. Steroids are the main, either be it in a topical form or be it in a systemic form. If it is localized, the eczema is localized, or it is mild, we can deal with topical steroids and anti-allergics. But if it is very much spread to the whole of the body, or it is very much severe, or which it's very much acute, we have to go with systemic corticosteroids. And if the eczema is persisting for long, like allergic contact dermatitis or atopic dermatitis, we cannot give corticosteroids for very long because of their side effects. We all know corticosteroids are double-edged sword. So in those conditions, you have to seek expert dermatological opinion, so that your dermatologist will give you some newer medicines, some newer immunosuppressants like cyclosporin, like tofacitinib, like azathioprine, which looking into the account the benefit and risk with these products, you have to seek a professional medical care. Now, one important thing, there is myth and the role of diet in eczema. There are few studies which tells that the phytochemicals present in and some food items like brinjal, like fish, like some elements, egg, these causes aggravation of some kind of pruritic conditions, including eczema. So if a person feels that his eczema or his pruritus is getting aggravated after eating those certain food items, he or she should avoid those items. But there are no definite links with any particular food items with eczema. Food and dairy products, the atopic individual, they should avoid to certain extent. Similarly, some protein containing items such as this peanuts and some seafoods, they are more prone to develop these atopic individuals some kind of rashes. So these individuals should prevent using, they should not eat those kind of foods, particularly with whom they find that it is letting them get increased amount of this eczema condition. So coming to skin care and clothings, skin care using of very mild soap to avoid letting your skin dry, because dry skin increases the itching, increases the severity of rashes or eczema. So you have to keep your skin very moist with help of using mild soaps, and use plenty of moisturizers, particularly just 2 to 3 minutes within bathing. When your skin is soft and supple, just use plenty of moisturizers. That will help you keep this moisturizing content of the skin, will help you against this eczema conditions. And similarly, the clothings, definitely the loose cotton clothes, light color clothes definitely help in every kind of skin condition. So you should use those kind of clothes also, and always seek a professional help. Never go with the over-counter medication, because eczema is a condition which will continue and persist for a longer duration. So you should seek pure professional dermatologist help, so that they will give you such kind of medicine which will not cause any such harm, and you will get proper relief with these medicines. So I hope all these informations regarding eczema and atopic dermatitis and contact dermatitis would be very helpful to you. And if you want to get similar videos or video related with these kind of topics, you can check out the website www.dermavidya.com. And as a doctor, my advice for any skin and hair related issue is do not self-medicate, and get in touch with a professional as soon as possible. Thank you.
For more such videos, visit or log into dermavidya.com.